everybody, and welcome to our show. This is From This Corner TV, and I'm Marilyn Dayton, your producer and your host. And the reason we're here is not just to entertain you, but to talk about topics that interest you and educate you. And as you know, we've had several shows where we've talked about health and wellness. And we've had many guests from many different holistic services. And today we have a very special guest with us, and he is Carlos Sepulveda, who offers acupuncture and traditional Chinese medicine to his patients. And let me tell you, he is very, very knowledgeable in his field. And our co-host, Dodi Millardo, is back with us. So let me tell you briefly about both Carlos and Dodi before we begin, okay? As you remember, Dodi is an author, a speaker, a philanthropist, and a TV personality. Her romance novel is called Penelope's Cruise, and I've read it 3 times, and it's really good. She's a relationship advisor who was a guest speaker last year on the Oasis of the Seas. That was, at the time, the biggest cruise ship on the ocean.
Yep, Royal Caribbean.
Yep. And she's been a math teacher and a tutor. She's a dancing diva. And she's a tireless fundraiser. And she's enabled more than $150,000 to go to charities from her networking. And she's co-host of another TV show, which is called Just Saying, out of Brantford, Connecticut. Mm-hmm. Now, Carlos Sepulveda. Did I get that right?
Hey.
See, I know him as Carlos. It's hard. So he graduated summa cum laude from the New York College of Traditional Chinese Medicine with a master's degree in applied health science and acupuncture. And during this time at NYC TCM.
That's a mouthful.
Oh, yeah, it is. He twice received the President's Scholarship Award for, do I say didactic or didactic?
Usually didactic.
Didactic. And clinical excellence, and was invited to speak at his graduation as the valedictorian. I always wanted to be one of them. And class representative. Now, Carlos utilizes acupuncture and other supportive traditional methods, such as tuina, Chinese medical-based manual manipulation, which is really kind of cool, patent herbs, and moxibustion, which is a good word, to address a large variety of patients' issues, and we're going to talk more about that. Integral to his practice is his 17 years of experience in Tai Chi Chuan, and Chinese, Indonesian martial arts and health practices. We're going to talk a little bit more about that too. Carlos has his own practice at Healing Health Acupuncture, as well as working with Everything Zen Massage locally. And welcome to the show, both of you. Welcome back, Dodi, and welcome,
Thank you so
Carlos.
much for having me. I really appreciate it. It's good seeing both of you.
I've been wanting to have you on the show for a long time, So, Carlos, let's start with the fact that you needed treatment at one point. You were injured.
Right. It goes back to my days when I was working steel construction. I had fractured my kneecap. I fractured my patella on my right leg. And being a typical guy, I ignored it. I could still walk. I could still work. I'm fine. Over time, I developed a lot of swelling on the knee. And I went to go see an orthopedist and, took very good measures, like mobilized the knee, made sure that the fracture was healing. And it was mostly healed at that point because I ignored it for a significant period of time. So that was no longer an issue. The problem was I kept having this swelling on the knee. So I had it aspirated a couple times, which means just draining the knee basically of the fluid. But every time it would come back. Again, with my experience in martial arts, I make up with friends in a lot of different areas. And I had a friend who was an acupuncturist, and he kept bugging me to come down and see him, And finally, after, I didn't feel like anything was working. I just didn't want to wait the months it would take for it to resolve on its own. I went to see him, and after several treatments, not many treatments, with acupuncture using something else called moxibustion and the tuina that you just talked about, the swelling went away, never came back. And I'm a very results-oriented person, and when I saw that, I was hooked at that point.
Now, you were in the construction industry. and that's how you got injured, right?
Right.
So, Dodie, I think you were going to ask him a question
How
about
did you
that.
go from the construction industry to wanting to become an acupuncturist?
Well, again, this
Was it
goes back
was
to my...
it this injury?
This was the turning point for me.
Yeah.
For a variety of reasons. One, I had this long experience with martial arts, and in the Chinese and Indonesian martial arts, health practices are a large part of it. If you're not healthy, you can't train, right? And
Yeah.
the first part of self-defense is being able to get out of bed in the morning.
I would, yeah.
So I had been exposed to a lot of the different, because a lot of the philosophical concepts between Chinese medicine and what they call the internal martial arts are very similar, come from the same sort of ideas. So I'd been exposed to it in the past, and it had always been in the back of my mind. As I gotten older, I realized that working steel it's a young man's game, And unfortunately, I'm not getting any younger. If I figure that out, I'll let you both know.
Please.
And,
Yes,
and we
please
can,
do.
we
Doesn't
can, we can pat
acupuncture
it
help
back.
this?
We'll talk about that too.
Okay. Okay.
So it had always been in the back of my mind, and I had wanted to kind of finish my schooling and when I figure out what I wanted to do with the rest of my life. And we gotten to the point where the economy had kind of hit the skids, and construction had again fallen off. Always, when the money dries up, the work dries up. So I was looking for a different direction in my life, and going after this experience with my knee, and kind of seeing where my heart was. You want to do something with your life that you care about, that you look forward to doing every day. Not that I didn't enjoy the construction, I did, but I realized like my time was limited when I could be healthy and happy doing it. So I made the leap into doing this, and it's again not an easy decision. I mean, acupuncture school is typically beyond a bachelor's is 3 years, and I knew it would be taking a lot of time away from. I'm married with 3 children, the highlight of my life, and I would be taking a lot of time away from them in order to pursue this. So it wasn't a slow decision. So was it to happen quickly, to happen slow? The answer to that question is yes.
All of the above.
A lot of time thinking about it, but when I made the decision, I went to go look at the New York College of Traditional Chinese Medicine and felt at home. And so with my family's blessing, I made the leap, and that's what got me to here today.
And I think that's important, that your family needs to be a part of that kind of decision, because you were starting all over again
Yeah. From scratch.
square one. Yeah.
Absolutely. It's important. When you make a decision like that affects everyone's lives around you, they have to have a say in it too. It's only fair.
And the transition from completely different industries.
Right.
It's not like you can say, okay, I'm going to start out working from a room in the house, and you go and you open the front door and they pile in. It just doesn't work that way.
It does not work that way, not even the slightest.
So did you, but yet you were changing careers, so you
Right.
had to get it going pretty quickly.
Pretty quickly. And there was always that transitional time where I was doing both at the same time,
Yeah.
for a short period of time. Getting constant reminders that my body was not ready to commit to that other line of work for the rest of my life was also a lot of impetus in this decision as well.
May I ask if you used the word soul before we went on air?
Right.
And I think that's another aspect of this career decision for you. That did it touch your soul? Was there something deeper than just a career change going on here?
Absolutely,
Yeah.
absolutely. I come from a family that has a lot of healthcare practitioners in it. My father's a doctor. My sister's a doctor. My grandmother was a nurse. I have an uncle who's a doctor, and an aunt who's a nurse as well.
Wow.
So it's something that I grew up around, and there's something so satisfying by being able to improve someone else's life. Outside of just the people around you. Everyone wants the best for their family and their friends, but able to help someone find something in their lives, to improve what's going on with them, to kind of unshackle whatever issue they have is holding them back from enjoying or really partaking of all aspects of their life.
So you come from a medical family. Yeah. Did you at any time consider going into the Western medical field, or? Absolutely.
Of course, made this decision. I was I think 39 at the time. So realistically, I didn't have the time to become an MD, right?
Yeah.
And again, like I said, I spent a majority of my adult life involved in the kind of Chinese and Indonesian martial arts that, again, have the same sort of philosophical roots that Chinese medicine does, and it seemed a natural progression to me.
Eastern medicine is so different from Western medicine. And when you combine the two together, it's called complementary medicine.
Right.
And
Or integrative is another term that they use.
right, yeah. And one thing that I always want to stress to people is if you've got a doctor, Western medicine doctor, that's important. That's what you have to have. But there's nothing wrong with complementing that treatment with Eastern style medicine. As a matter of fact, you're much more, it's much more effective. I found my own personal experience.
I couldn't agree more with you. I couldn't agree more with you. I think you really see that nowadays. That's really where our healthcare system is going. Everything has its strong points. You know, acupuncture has its strong points, herbal medicine has its strong points, but so does Western medicine and the pharmacology in Western medicine as well.
And the World Health Organization recognizes that.
Yeah, absolutely, absolutely. There's a huge list of different disorders and issues and diseases, whatever term you want to use, excuse me, that the World Health Organization has seen fit to call acupuncture an effective treatment for.
Cool. And can you tell us like what some of those are?
Oh, absolutely,
Yeah.
absolutely.
What do you find acupuncture to be particularly good to help?
Well, all right, particularly good.
Or those, they may be two very different questions.
Not really,
No? Okay.
not really, not really. Again, every different modality or technique that you use for treatment has its strong points. But really in this country, what people are most familiar with is using acupuncture for pain. Pain relief. Works fantastic for working on different sorts of pain relief. We're talking, migraine headaches, cluster headaches. We're talking issues like lower back pain, sciatica, neck pain, tennis elbow, frozen shoulder, all sorts of sports injuries. It does a fantastic job. I think as we get into it a little bit and I explain kind of what, from the Chinese medical point of view, what acupuncture is working with, what it's doing, you'll see why the list of these different conditions on the World Health Organization you will see that they involve almost every system of the body. That's actually an effective treatment for all sorts of reproductive issues, dysmenorrhea, amenorrhea, infertility, impotence. It works with really well with a lot of gastroenterological issues, gastritis, IBS,
Yeah,
gastritis,
really?
constipation, diarrhea, all sorts of issues like that, nausea, a lot of nausea as well. It actually helps with eye issues as well. Treatment for conjunctivitis. One type of cataracts actually has seen a good response with acupuncture as well.
Oh, really?
And what does it do for the cataract? Does it get rid of it?
It helps reduce it. Again,
Wow.
cure is never
Yeah.
a word you're going to hear
Okay.
me use.
Yeah.
I think what's key with any sort of medical treatment is to looking as a progression. Am I better off today than I was 2 days ago? Are we moving in a positive direction?
Now, I'm interested in the cataract because I've got little ones. Not the right kind of little ones.
Well, I
I've got
do too.
little cataracts.
Yeah.
in
right,
here.
there's a very
Yeah.
specific type, and we can talk about that, I guess, a little later.
Yeah.
That it works with. But another aspect of what acupuncture has been shown to be good for is our psycho-emotional issues. In Chinese medicine, the idea that what's going on with our psychological, emotional, is not separate from our physical issues. They all have a reciprocal relationship. I mean, just a simple example, when you're in a lot of pain, you're emotionally not the same person. I know every human being is more irritable, right? Is very sensitive to anything.
And depressed.
And depressed,
Yeah.
right? And they go hand in hand. And again, like I said, it's not a one-way street, right? So when we have these psychological issues, Chinese medicine recognizes that it'll have a physical manifestation as well.
And Chinese medicine, Eastern medicine treats the whole body.
Right. It's a very holistic approach.
Yes,
we treat
very.
the human as they are at that moment.
Whereas generally, and I'm speaking generally, Western medicine
One spot.
treats one spot,
Your issue.
one
Whatever
issue.
your issue is, right?
You go in and they say, okay, you've got this, and we're going to do this. But in the meantime, there's these emotional reactions. You go, oh, I've got that. Is it going to go away? Can we fix it? And then sometimes there's a spiral of medicine, treatment, and then reoccurring. But if you include the whole body, and treat, take a look at the emotional issue that comes with it. It's just so much more effective. So, as you can tell, I'm kind of a fan of the Eastern medical psychology and philosophy here. So, okay. So, please continue. I didn't mean to.
What you had something to say.
You had suggested that once people understand how acupuncture works, then it would be easier to see why it works so well in
so many different systems in the body.
So would you explain that to us?
All right, well, the stock answer of what acupuncture is, and it's only one aspect of Chinese medicine, and after we go through this, I'll talk about the different branches of Chinese medicine. The stock answer is that it's inserting sterile single-use needles, very, very thin needles, not like the needles that you see when you get a shot at the doctor. Have no lumen. They're actually smaller, thinner than a human hair.
Oh, are they?
Yeah.
Oh, wow.
And so inserting them to specific points on the body in order to regulate and rebalance the body's different systems, organ systems, circulatory systems, nervous systems, in order to affect overall health. Very easy to say that, but really what's going on, right? There have been a lot of studies recently from a clinical point of view and from a research point of view showing kind of what's happening in the human body from a Western medical standpoint when these needles are inserted at these specific points. One thing that's been shown is that it increases local circulation. A lot of where these acupuncture points are, they've found recently that they're clusters of microvessels and small nerve clusters as well. So actually these points are affecting both the circulatory system and the nervous system. That's not the chief effect, but they do have an effect on that. And obviously, increasing circulation is important for any sort of healing process to bring new fresh blood into the area and help rebuild tissue. Another thing that has been shown is that these acupuncture needles actually stimulate collagen production in the body. Collagen is the most prominent protein in the body, and a lot in facials, and facial acupuncture is definitely one of the applications of it. But it's really, if you find collagen everywhere in the body. It's in our bones, it's in our organs, it's in our skin. It's everywhere, and it's actually one of the materials we use in order to rebuild ourselves. So acupuncture has been shown to actually increase the amount of collagen that we produce. Again, stimulating and kind of accelerating the healing process.
And that's why some people get acupuncture treatment as they call it a facelift.
Absolutely, it's a facial treatment. It's becoming more and more popular. Another thing that it does is that in a recent study, they've shown that it increases the production of beta endorphins. Beta endorphins are our internal pain blockers. Right.
Which is
exactly. So when acupuncture goes a long way for us to understand why acupuncture does work so well for pain, for a lot of different issues. We're actually stimulating production of our own natural pain blockers, and it's also in that same study shown that it also reduces reduces the amount of interleukins in the body, which are basically our inflammation markers. When there's inflammation in the body, among other things, these interleukin levels are higher. So they actually measure these levels after acupuncture treatment, and they're lower, so it actually helps reduce inflammation in the body as well.
Which helps reduce pain.
And reduce pain and discomfort.
That's interesting.
Right. Really interesting stuff, really interesting stuff. And I'm sorry, I didn't mean to interrupt you.
So would that then be a good support rationale for making acupuncture sort of an ongoing maintenance for your body, doing acupuncture every couple of weeks or whatever, because I'm aware of inflammation because of arthritis and disc problems and things like that. And when inflammation goes down, the pain goes down. So if you can keep the inflammation levels low, then a lot of other good things happen in your body. So it almost sounds like, wow, it would be like a nice maintenance thing to go every couple of weeks, every month to get.
It can. I mean, the treatment model, the typical treatment model, if we're looking at it in China, the typical treatment model is one treatment a day for 10 straight days. You take a break for a day or two, and then you go through another round of treatment like that. For most things, not for infertility, that's a different issue. That's something that will require, really the best results they've shown in this country at least are twice a week. At least initially, and you have to go through 3 cycles in order to regulate the menstruation, which is the most important aspect in order to prepare the uterus for what you want done. So in any case, I'm sorry. Let me finish. I digress.
So maintenance. No, he was going to.
Right.
Yeah.
So do people come for maintenance? Yes, absolutely. Typically, how we approach a problem and understanding first schedules. The reason that works in China is because it's a communist country and people pay like 26 cents for a treatment. That doesn't work here, right? Our very hectic schedules and the financial aspects of it kind of are prohibitive to approaching it that way. Typically, we'll look at a problem, obviously problems that are chronic, things that something you've had for 20 years, I wish I could say I'm going to fix it overnight. No one's going to fix it overnight. Right. Things that happen slowly take time to unravel that. They built up a lot of momentum in our body, and our body likes to follow these set patterns because it's easier that way. So it's kind of stopping that train and resetting your body and allow it to move forward in a more healthy pattern. And that takes time. Normally with most, like say an issue like you come with lower back pain, you've had lower back pain for 15 years. I would say we'll do once or twice a week you can do it, but typically once a week we'll go for 8 weeks. And then we reevaluate and see where we are. Are you going to be healed by the end of those 8 weeks? I would never tell anybody you're going to be healed by the end of 8 weeks. But you should feel relief. You should feel relief after the first treatment. Right. And like any other treatment, like physical therapy, like medication, acupuncture is dose dependent. You're going to get better results doing it once, twice a week for a set number of weeks, and you are going to be doing it 1 week here. I go for a month. I take it over here. It just doesn't work that way. What's interesting about acupuncture though is that the effects are cumulative. So after your first treatment, and we'll go back to typical back pain, right? I know every acupuncturist out there is going to tell you they've seen back pain patients because that's that's stock of what we do. So a typical, you come for back pain, you should feel relief after the first treatment, right? We usually use something called the pain scale as an 8 out of 10. I want you to get you down like a 3 or 4 or 2 before you walk out of the door. Use a variety of techniques, be it the tuina, be it cupping, be it acupuncture in order to achieve that. But in all honesty, it's probably going to come back in a day or two, right? Again, because we're trying to rebalance the body and start these new, healthier patterns. So after the next treatment, maybe it lasts a little bit longer. And the treatment after that, maybe you go a whole week without pain. The treatment after that, maybe you go a couple weeks without it. And then after that 8th week, we reevaluate. Do you continue coming once a week? Maybe you skip a couple weeks, see how you do with that. And it's fluid like that. Give me 1 second.
Every time you say back pain, I go, oh yeah. Oh yeah. I mean,
Everybody
we're both
does.
sitting here going,
If you're a human being, at some point in your life, you're going to have back pain. We're still evolving biologically from creatures that walked on all fours to ones that walk upright. So, we're a work in progress. And on heels. I envy you that not at all. So we're a work in progress. So we kind of covered some of the things that happens from a Western medical point of view, like what they've seen. Chinese medicine comes from a different angle. It uses the concept of qi, and I don't want you to think qi is this sort of magical woo-woo up in the air. And what's really nice about acupuncture, it's not a faith-based medicine. You don't have to believe in it. And frankly, I prefer people to be skeptics. And I think you should be skeptical of everything. Ask all the questions you can and get all the information you can. And that's the advice I give to everyone that comes to see me. In any case, you can think of qi as the motivational force behind every system in the body. It's why we talk. It's why our lungs work like a bellows. It's why our heart beats. It's why our circulation goes. And this runs everywhere in the body, right? It runs through every tissue, every organ, every bone. But in particular, it runs through these things that we call meridians. You can think of them like they're a pipe system. I even had one of my professors in school tell us that we were just glorified plumbers.
Oh boy.
Okay.
Why not?
So it runs through these things called meridians, and these meridians run through different specific sections of the body and have connections to various organ systems in the body and directly to the organs themselves. And when we run into issues in Chinese medicine, particularly with acupuncture, we run into issues is when there's not enough of this qi stuff running through us, or it gets stuck. Usually a combination of the two, right?
Okay.
So all I'm doing with these sterile single-use needles is giving your body signals at these specific points to adjust the flow of this qi in the body. And by adjusting the flow of this qi in the body, we kind of restore the body to a healthier operating system, a healthier balance.
I think if you do, think about it as a plumbing system.
Or an electrical system, one of
Something
those.
along
Yeah,
those lines,
and
or
you think
some
of,
kind
oh, I gotta-
cross between those
Yeah.
things.
Yeah, and you're blocked. Sorry. Then that does help explain it a little bit better. And so acupuncture kind of unblocks and encourages the qi.
The qi to flow
the energy
smoothly
flow,
throughout the
right.
body. Right. I mean, there's a saying in Chinese medicine. There's lots of sayings in Chinese medicine. There's a saying in Chinese medicine, bu tong zhe tong, which just means no movement, there's pain.
That makes sense.
Sure.
Right? So when things
Yeah.
get stuck, there's pain. Right? So really, what these needles are doing is just unblocking these things or helping things flow more smoothly to work through these blockages, to release the body to operate the way it wants to work.
Wow. That's, you know what? Now is a good time to take a little break, and then we'll come back and continue the conversation. Okay, and we'll talk more, because at the bottom of the hour, we have to take a little break.
Sure.
And we'll drink some water, and and make sure you've got your pen and papers out, okay? Because we all have pain. And guess what we do about that? We call Carlos, okay? So we'll be back in just a second.
Can you help me with this? My new dad teaches me all kinds of stuff.
Sure.
He helps me with homework.
That would be 3.6795.
Thanks.
Yep.
He helps me with my decision making.
I wouldn't use this one. Ever.
And he's even teaching me how to drive.
And that's why cars have bumpers.
I'm learning so much.
You don't have to be perfect to be a perfect parent. Thousands of kids in foster care will take you just as you are. When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who take action are far more likely to get the most positive outcome. Making Home Affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
There's a shelter pet who wants to meet you. Meet one today. Visit theshelterpetproject.org. Adopt.
Up, college is hard. Down, those books are heavy.
My sport is football, but my passion is education.
Right up here.
So every year I take promising high schoolers on a college tour
Lights there, darts there.
to show them that higher education means a brighter future. My name is Nnamdi Asamoah. I don't just wear the shirt, I live it.
You can be a reader, tutor, or mentor too. Take the pledge at liveunited.org/volunteer.
Do you wear this?
Welcome back to From This Corner TV. We have a very special guest today. As you saw and heard in the first half of the program, we're talking about acupuncture and Chinese medicine. And we have a very special guest with us, Carlos Sepulveda. Every time I say, I don't speak Spanish, but okay, that sounds good. So one of the things that I wanted to say was, Carlos, on your website, on the About page, it says, universal is the profound positive change, the relief a person receives from treatment makes in their life. That's a hard sentence to say. But basically, there's a profound positive change that this treatment can make in your life. And can you explain to this? That's probably based on a Chinese.
It's more based on my observation and my interaction with patients and my own personal experience with any sort of medical intervention. You know, I'm not going to take the credit away from anything else. Any positive medical intervention in someone's life. When you're suffering from chronic back pain, when you're suffering from anxiety, insomnia, when you're suffering from carpal tunnel syndrome, it restricts aspects of your life. You know, back pain, you can't move around like you used to. You can't go outside. You can't play with your kids. You can't go for a walk in the woods. You can't interact with the parts of your life that have brought you joy up to that point, you know, and it's detracting from the quality of your life.
Yeah.
When you have insomnia, you can't sleep at night, or you're waking up and you're up for hours at a time. It's detracting from your life. You're not rested the next day. You're short-tempered. You're super sensitive. You're exhausted all the time. You can't do the things that you want to do. You're not the person that you want to be. When you have, say, something like irritable bowel syndrome, it restricts where you can go and when you can do things. You never know when, you know, depending how severe it is, when you're going to be able to go to the bathroom, be it the constipation aspect of it, or can I even leave the house because my diarrhea, I don't know when it's coming. These are all things that have, again, physical and emotional restrictions that they put on your life. And so when you provide relief for someone, and I'm not using the word cure, but any sort of relief, any sort of mitigation of these symptoms, you recapture parts of your life. You get things back that you had lost because of whatever situation you were in. And that's why I got into it. That's given me the greatest joy in doing this, is seeing other people get that out of what I'm doing.
And acupuncture can treat pretty much anything, can it?
Again, everything's got its strong points, and we went through kind of like a short list of what the different disorders that it works with, and not just acupuncture. You know, like I said, I practice traditional Chinese medicine, and you look at Chinese medicine, you can look at it as a tree, right? The roots of Chinese medicine came from a philosophy known as Taoism, the theory of yin and yang. I think everybody's heard of, and from that, over time. Thousands of years ago, I think there's a book called the Huangdi Neijing, the Yellow Emperor's Classic, that's over 2,600 years old. And a lot of the concepts in the book are the same concepts that we use in Chinese medicine today. And this is kind of think of it as the trunk of the tree. Now in terms of treatment, these are the different branches of the tree. Acupuncture is just one of the branches. Another very important branch is herbal medicine. And there's a huge pharmacopoeia of different herbs and formulas. One of the strong points of herbal medicine, I think, in Chinese medicine is that all these formulas are balanced, so you don't get side effects, right? That you get a lot from a lot of single drugs or single herbs, that you'll get a lot of the positive benefits, but you get toxicity or you get other side effects along with it. That's all these formulas are balanced in order to address the situation you want to address and not cause any side effects, which is a very strong point in that. Another thing is the tuina that we talked about earlier. And you can look at it as a cross between massage and sort of some aspects of physical therapy as well, using the same theory as acupuncture and herbal medicine, approaching it from a Chinese medical point of view, using the meridian system and the associated muscular pathways that go along with the meridian system. The meridians aren't just, I don't know if anybody's seen the charts that you can look up online, have all these, looks like a road map over the body. But that's just one aspect of the meridian system. The meridian system actually have deeper channels that connect those. They have channels that crisscross those channels that you see and connect them in that way. You had asked earlier before you came on air about why treating a point on my arm is going to have any effect on my knee or my lower back. It's because all these pipes are connected. And just like in your house, a problem in a bathroom upstairs could have an effect on the water coming out of your sink, right? Maybe, I don't know, I'm not a plumber, I'm just kind of using that as an analogy.
Not that kind of
wrong degree.
Wrong degree, right. So that's why these are all connected, and the body is a unit. So as I affect the channels here, it's going to affect on the flow of the chi in the body and the entire body, so it does have an effect on opposite points of the body as well.
Does
So we've
acupressure
It does.
also use the same meridians?
Same meridians and same points as well.
So if you were going to treat pain in a certain spot with the acupuncture needle, could you get a similar effect by using pressure in that area?
Absolutely.
Okay.
Absolutely. And there are a lot of points that work very well with pressure. In my experience, though, the acupuncture needle is a finer instrument, and I've gotten better results with the needles than I have with the acupuncture. But I've used both with people to effect. I think I was talking about the meridian system not just being these pathways going down the body. They're actually associated with, again, deeper pathways, and they're actually pathways that come off these ones that you see, this roadmap, to connect with the actual organs themselves, with the kidney, with the liver, with the spleen, with the stomach. And they're actually muscular pathways as well that are associated with all these groups, which is another reason why if I treat a point here, it's the same muscular pathway that attaches down here, right? So you're actually approaching it from various different angles. Which is in my opinion, is a good way to go at anything, which is why I employ these different modalities. Back to the tree analogy as I digress and digress. Another technique in Chinese medicine, not much different than herbal medicine actually, is nutrition. Nutrition is an important part. Food is medicine that we take every day, 3 times a day or sometimes more, most times more. And it can have a huge effect on our bodies, right? Everything we put in our body is the fuel that we work with and what we build ourselves out of. So it has a huge effect as well. And another thing is, look at it as exercise. We call it qigong or tai chi is another form of exercise when used just for kind of health. So you look at it from different aspects. You got herbal medicine, you've got nutrition, you've got acupuncture, you've got like manual, a manual modality with the tuina, and then you have exercise yourself, and all these different aspects together help keep a person healthy. And I think it's always best coming at a problem from various angles. Very rarely does one problem have one solution, at least in my experience.
Wow.
You mentioned another treatment called moxibustion?
Yes,
Is that-
moxa.
Yeah, what? I've
moxa-
never heard that word
Moxa
before.
comes from the, it's an herb actually. It's
Oh.
in Chinese, it's aye. It comes from the mugwort plant.
Okay.
And it's, I'm not totally sure, but I think it's scraped from dried leaves and rolled into a puffy substance. And we burn it, basically, and we use it both for the kind of nature of the herb itself. It's a very moving herb, kind of breaks up stagnation, gets things moving. And the heat from burning this herb tends to penetrate deep into tissues as well, so we use it for kind of a heat therapy as well. And you can use it for all sorts of different issues in the body. Again, it's just one aspect, like one tool in your tool belt. You know, another one is cupping.
Oh yeah, I've heard
And
of that. Can
not
I
just
go back to this one for
Yeah,
just
absolutely.
So somebody comes in and you're going to treat them with moxibustion. What do they do? You're going to take this herb and burn, like...
There are different ways, there are different
Yeah.
applications of it. One is typically you see as a moxa stick. It looks like a cigar,
Okay.
And you burn it, and they either sell holders or boxes that you can put on top of the body that catch the ash, so you don't burn someone. That's first and
Right.
foremost.
Is it like incense or a smudge stick or something?
Sort of.
Okay.
Very similar, but thicker, more about the size of my finger. And then you can hold it over the point and kind of press it in and kind of modulate the heat as you keep your hand on the person's body, because again, you don't want to burn anybody with this, right?
Yeah.
There's also something called direct moxa, where it's in a looser form, and you can form it into cones or smaller pieces, and either use a medium, such as a slice of garlic or a slice of ginger,
That sounds
and
good.
put that on top of it, and then you burn it directly on top of the medium over the body point itself to generate a lot of heat. Can also use salt as a medium as well. For particular issues, you can make something called a salt box, put it over a certain section of the body, fill it with like a kosher salt or the pink Himalayan salt, and make a cone of the moxa and burn that directly on top of that. And this salt has again, its own nature, right? So it combines with the nature of the herb as well.
Never heard of
The
this.
smoke penetrates the skin, the smoke has an effect, and then the heat is dissipated into the body, having an effect as well.
The interesting thing with moxibustion, I've had it done
Have you? Okay.
before. Yeah, Howie has done it on me before. It helps sometimes to do that during or before massage, and or with it, as well as cupping. I've had that done too. And can you explain to us what happens with cupping? Because so many people, they say, well, Jennifer Aniston does it, why does she do it? And Gwyneth Paltrow. What exactly is cupping?
Cupping is basically providing negative pressure over a section of the body. Traditionally, the way we would do it, we would use glass cups, use fire, a burning alcohol pad, to burn out the oxygen inside the cup, providing a vacuum at that point. So you place that over the body, and it pulls up on the skin, and also pulls on the subcutaneous tissue and any fluids in the body. So it tends to bring up, what we would call in Chinese medicine stagnant blood, but congealed blood, congealed body fluids, pulls them up to the surface, allowing fresh blood to come underneath and nourish those tissues that have been neglected for so long, right, with this stagnant blood and bound muscle tissue and all these other things, and allow healing to happen while it pulls it up to the surface and allows your body to dissipate it that way. Relieving stagnation. Again, we go back to the idea of that. Once stagnation, there is pain. Stagnation is a huge issue, and it translates not just to physical issues. I mean, you use cupping for all sorts of muscle aches and pains and chronic issues. But that stagnation, again, like our emotions and our psychological well-being are tied in with our physical well-being when you look at it from a Chinese medical standpoint. When we relieve these stagnations in our emotional states tend to have an effect as well. And I've seen it on the table as well, treating someone for lower back pain, and they'll start crying, not from the pain of the needles, but they'll start crying on the table because they feel this release. Yeah, they feel this release.
Wow.
Right? So it never ceases to amaze me.
That's amazing. Absolutely. The more I learn about...
I'm in the same boat. The more I learn, the more amazed I am, and the more I want to get into it.
And the more I understand, and you have such a great way of explaining things. I just, I love it.
It was an interesting experience for me. I went to New York College of Traditional Chinese Medicine, and the majority of my classmates were Chinese and Korean. And they have a huge head start because culturally you grew up with this, and I grew up in Connecticut and the West Coast and Iowa and West Virginia, and that wasn't part of the culture.
Yeah.
Yeah, exactly.
So
yeah.
it was kind of incumbent on me to make it in a way, to take all this information and absorb it in a way that was understandable to me. And in doing so, I kind of made it easier to turn around and explain it to another person without that kind of cultural background. That would understand what these concepts are, because and it's tough to understand this medicine. It's tough to learn this medicine without having the insight into the culture as well, because it is so tied in with everything with Chinese culture, and that's where the martial arts kind of gave you a head start, because that was another window into that and the culture as well.
What I love is when I talk to you about something, you automatically understand and explain so well. And like that one day when you were pressing on here, and I was going, oh my God, gosh, that feels really good. It's like instant relief.
It definitely can be. It definitely can be. And to this day, it still never ceases to amaze me when that happens with the patient. I love it. I love it. It's that little kind of poke in the back, like, all right, you're doing the right thing.
Yeah, right.
Poke in the back, yeah. But it's just not one time. One time does not, as you were saying.
Again,
one
with
time won't do it.
any sort of medical treatment, right? It's dose dependent.
And one of the things that you mentioned earlier was the World Health Organization. On your website, there's a list on the left-hand column of a variety of disorders that can be treated with Eastern, Chinese medicine, and many of them have been sanctioned by the World Health Organization, recognized as an integral part of treatment, to be used separately or to be used with Western medicine.
And to me, that's where I'm really happy to see the kind of changes going on in our medical system. I think we're catching a wave now of integration. The school I went to has a clinic that works out of Governor's Hospital in New York that provides acupuncture for post-surgery patients. I know of at least one gastroenterologist in Connecticut that employs an acupuncturist on staff to help with various gastrological issues like IBS, like gastroparesis, where your digestive system stops working, basically slows down. You see it in a lot of, particularly auricular acupuncture, you see it in a lot of rehabilitation and recovery. There's actually something called NADA, the National Acupuncturist Detoxification Association, that actually started in a hospital in the Bronx. A 5-point protocol for helping addicts recover and calming down. So it's.
I was going to ask you about addiction.
Yeah,
Is it,
absolutely. It definitely helps. It definitely helps. Yep. And so it's more and more. It's becoming accepted more and more. I even there are places that service terminal cancer patients and use acupuncture and palliative care for that as well. So it's becoming more and more accepted, and to me, that's the future. And why not take the best of what we have and the best of what other cultures have come up with and put it together? Because going forward, we're all human beings, so why not do the best that we can? Again, more tools in the tool belt. It's never a bad situation.
Is it effective for muscle tone and weight? We had this conversation earlier. Muscle tone and weight loss?
More and more, it's being used for weight loss. It's one aspect of it, right? You're not going to come get needles put in you and drop 30 pounds, right? I wish.
Yeah.
But it can be part of an effective program, and that's going to involve nutritional changes, lifestyle changes, getting to bed earlier, sleeping the correct amount of hours. If that's an issue, then we can address that issue. Nutrition and exercise. But can acupuncture help? Absolutely, and I've seen it help people.
And weight problems. I see overeating as an addiction. To me, it's an emotional. I do emotional eating. A lot of people do emotional eating. And it would be like an addiction. And
again, we look at one of the ways that we diagnose things. We look at the effects of different organ systems. And for example, the kidneys. If we're talking about the kidneys and I see there's an issue with the kidneys, doesn't mean you need dialysis. It doesn't work like that.
Right.
In Chinese medicine, these organ systems, though they have the same names as the Western organs, they're more functional relationships. So the kidneys, we talk about reproduction, we talk about your lower back and your knees actually have a lot to do with, they're called the palace of the kidneys in Chinese medicine. They have a lot to do with that because of the associated muscle groups. We talk about that being the root of kind of what you get from your parents is stored in your kidneys. All these different issues, all these different functions that the kidneys provide. And it's true for every organ group. And there's also an emotional aspect to each. They each have an aspect of something that in my Chinese medicine we call the Shen, the big Shen. And the aspect that the kidney has to deal with is called your will to enact things, your will to follow through on things, right, to move forward. And these organ systems, when one of these functions has a problem, right? For example, say you're hyper appetite, you're very hungry, and we would tell you that would have to do with the spleen, stomach system, right? And but what is causing this, right? So it points me in that direction. So I would actually address the spleen, stomach system, and alleviate what's going on with that, or if another organ system, because they all have an integrated relationship, and the way one works, it tends to affect all the others, just like being in a family. If your younger brother's throwing a tantrum, it's going to affect your parents, which is going to affect the way they treat you, which is going to affect the way you treat your sister, right? Same sort of idea in Chinese medicine. Well, they all work together. So I would look at the spleen system and what's affecting the spleen system, and then we could approach it from that perspective. Because again, the emotional, physical, and psychological are not separated. They're all parts of the same being. So that's the way I would look at that particular situation, is what I'm trying to explain.
So that's why when someone wants to come to you, they have to sit down and talk with you about everything, pretty much, so that you understand their entire
Right, because we treat the whole
entire
person.
body.
We
It's holistic,
Right,
right.
we don't treat the
Right.
symptom, we treat the person.
Right.
Because it has a root somewhere. We talk about, Chinese medicine, we talk about roots and branches, right? Branches are the symptoms. I've got insomnia. I wake up at night, I'm up for 3 hours, I'm pacing around the house, I toss and turn, I'm all sweaty. So it's not like I do that point for insomnia, you go to sleep, everything's okay. There's a reason that happens, right? There's a root cause of that. And typically, the most effective treatments are the ones that address that root cause, not just the symptom itself. You address the root cause, the branch goes away. So that's what's important when someone comes in, is to get a full health history. I'll sit down with you. I have intake forms. You give me kind of like your health history, and then we'll talk. And I'll ask you a series of questions that may seem completely unrelated to what you came in for, but they're all designed to deal with a different system of the body. We call them the 10 questions in Chinese medicine. They're more than 10 questions, but they're 10 topics, basically. What it does
counting.
is, yeah, exactly. It helps me refine and narrow down my diagnosis. And with any medicine, the closer the diagnosis is to actually what's happening, the better, the more focused treatment's going to be, the better the result's going to be.
And you find yourself using several of your modalities together to treat something?
Typically, my experience and what I've gotten from my mentors and my supervisors and professors in school, you learn that everyone has their own slant on it. They make it their own personal expression. Just like music, right? Everyone learns the same notes, but the way you express it is different than the next person. And it's the same thing with this. With any sort of like personal expression, that's the way it works. But I've seen great results from combining acupuncture with the patent herbs, with giving them qigong exercises to do at home, with making some lifestyle recommendations, according to Chinese medical precepts, with giving them simple breathing exercises to help relax, and to kind of get a better feel of what's going on in your body, and just to be able to listen to what's going on with your body. The more we listen, the more our body tells us, and the more we know what's going on.
What if we come to you and we have a list of problems? Where do you start?
If you've been alive longer than 15 minutes, you have a list of problems.
It doesn't make you feel bad. It's so fabulous.
Yeah, I know.
Well,
So typically people come in with a list of things, and you'd be surprised. You'd be very surprised when, say someone comes in with, we'll go with the insomnia. I wake up at night, I'm very sweaty, I feel anxious when I wake up, I toss and turn, I can't get back to sleep. I've got right knee pain, I've had lower back pain for years. Sometimes I tend to have burning urination, and these all seem completely unrelated issues.
He's talking about me.
Right.
Okay.
completely unrelated issues, but from a Chinese medical standpoint, they all have to deal actually with the same sort of syndrome. So believe it, your disparate list of symptoms, not saying they always fit into these patterns, because no one comes out of a textbook, we're all human beings. but these patterns have been developed over 2,600 years, so we've seen all kinds of varieties of people at this point. So all these laundry list of symptoms all usually point in similar directions, or if not, we kind of work our way through it until we find out what's the most important that's going on, and that's what we work with.
You thought I was kidding.
I
wasn't kidding.
I know you too well to know you're
Yes.
kidding.
Have we advanced far enough that our healthcare system, insurance, is covering some of these treatments?
More and more.
Yeah,
more and more.
That's a nice thing to hear.
Yeah, more and more. It's becoming more and more accepted.
Yeah.
Is it ideal? Well, is anything ideal? Right?
No.
You look at Chinese medicine, and I hate to say this, and from a Chinese medical point of view, I've never met anybody that's 100% healthy. And I've never seen any system that's 100% effective, right? We could always do better. We can always refine and get better. And that's kind of the point of being alive, right? You take what you did
Absolutely.
yesterday and try to do it a little bit better tomorrow.
Yeah.
That's my approach to it.
I wanted to ask you a question. Remember we were talking the other day, and I said, I used to have these tight muscles on my arms, and now
Right.
they're getting flabby, and you said, that's all right?
Well, what I meant was being relaxed was all right.
Being relaxed, right.
Relaxed muscle is all right. Muscle tension, right? Only time a muscle should be engaged is when you're performing an action, right? If you look at it from, again, it's from my Tai Chi experience, skeletal muscles, right? Biceps, triceps, quadriceps, they're not for holding you up, they're for movement, right? So if I'm just standing there and I'm all tight and taut and tense, it's like driving around with the brakes on. It requires a lot more energy. It causes those blockages and that stagnation and tension we're talking about. All you have to do is do a regular push-up or a squat, and then tighten every muscle in your body and try and perform the same action. You can see what the effect of having overly tensioned muscles are. One thing we do in what they call the internal martial arts, or most systems that have internal, external, it's a whole thing, we'll get into that at some other point, is to learn to relax unnecessary muscle groups that aren't performing a function at that time. You want to have, it's practicing to be lazy, right?
Love it.
Right? I'm only using what I exactly need to use at this moment and nothing else. There's no need for it, right?
You can do that?
Yeah, it takes practice. It takes practice, and over time, I've seen people that will amaze you with using just a limited amount of their body or movement or muscles or chi or whatever system you want to talk about in order to accomplish something. And the better someone gets, the less you see, right? So my point is that unnecessary muscle tension is not healthy. Right? Is it important to do resistance exercise? Absolutely. Part of any exercise program should be resistance training, along with like cardio training and other things along those lines. But I think an important part is also learning to relax the muscles as well. Relax what you're not using. It's not important. It's just taking away from you putting everything into what you're doing. Goes back to that stagnation causes pain. Stagnation, tension is not helpful.
We have a lot to talk about when you and I meet.
Okay.
Again. It's almost time to wrap up. Is there anything that you would like our viewers to very quickly think about as far as, they say, well, there's Eastern medicine, Western medicine. It's very confusing. It's helped you change your life. It's helped you be better as far as functioning as a person. Any last-minute thoughts that you'd like to share?
What I share with everyone, I know you guys are as amazed as I am. This internet is unbelievable. Like I remember having to go to the library as a kid, looking in the card catalog and trying to dig out these things with the Dewey Decimal System. Use the internet, research your condition, whatever it is, and look at all the different modalities or treatment styles that have results with it, and do your due diligence. The more you know about it, again, you come to a healthcare professional, and most people do it because they care and they want to help. But nobody cares about your health as much as you. And the more research you have, the more tools you have in your tool belt, the more bullets you have in your gun. And you can make it, instead of just, a matter of trust comes into any sort of like healthcare situation. But the more information you have, the more you can interact with your healthcare providers, Eastern, Western, I don't care, whatever. And the better your treatment's going to be.
Yep.
And that would be the last thing I say.
So we should be responsible for ourselves.
Yeah, absolutely.
Pretty much.
Absolutely.
not that you trust everything that's on the internet, but you can
No.
get
You can get a good
information.
idea.
And ask the experts that you're
right,
going to for
Right, right, absolutely.
And make educated decisions with what you learn, the background, with what you learn in research, and then talking to a healthcare professional like yourself. And I would go to you before anybody else, tell you the truth.
I appreciate that.
Because every time I talk to you, it's like you know, I've got a question, or we just happen to start talking, and I mean, you just blow my mind every time I talk to you, and I go, my God, this guy's a wealth of information.
I appreciate that, but in all honesty, I get that from you every time I talk to you. I learn something else about different aspects too. So,
Oh, we have a mutual admiration.
absolutely,
Here.
this
That's
woman
great.
is fantastic.
Yes.
And we're both eager to learn more.
Yeah.
You know, I'm in my 72nd year. I like to remind you every once in a while. And I'm still reaching out, learning, taking online courses. I want to keep up with things, you know. And you're the same way. You want to keep learning.
You have to. Life is about growth. And this goes back to my Catholic school days when I was younger. When Sister Mary Lucy told us, when you stop growing, you're dying.
Good point.
So I intend to keep on growing as long as possible.
Yeah.
So do
in on
I.
all aspects of my life.
That's great.
So do I. I'd like to thank both of you so much. Dodie, is always so great when you co-host with me. It's
A blessing to be here. Thank you.
Thank you so much for having me. I really appreciate
Oh,
it. I had a great
Carlos,
time.
it's just been amazing. And there's so much more to this young man. He's just a fountain of knowledge. I always like to finish with a quote, as you well know. And tonight's quote's from Josh Billings. And it says, "Health is like money. We never have a true idea of its value until we lose it." Isn't that the truth? And when you do lose your health or have a health problem, this is the guy you want to call, okay? You want to call Carlos. He is just amazing. Go to his website. There's a lot of information on there. And know that he is practicing in several locations. So, and they're all, you know, you can call him. It's go to the website, you'll find the information, you can contact him, and he wants to help people, okay? He wants to help you. So, give him a chance. I just keep learning so much from this young man. It's wonderful. So, remember to contact us when you've got an idea for a show, or you've got someone that you know and are learning from, like I learned from Carlos. Let me know. And we've got many subject areas that we cover on this show, and it's all for you. It's to educate you, entertain you, and interest you, okay? So thank you so much for joining us today. And we look forward to the next time. We'll have another interesting show for you, because we always do. Thanks for joining us today.